Okay, so guys, let's start. We are going to start the step one session, especially December session. In this 1 month session, we will try to cover the important topics on which you get the question in the U word or in the NBMEs. So before starting the topics, today we are going to have one orientation class, and in this class, I will let you know, guys, how you guys have to start the preparation. And if any student is using any kind of resource, so what is the best method to use that resource? Like if the person is using the uword or the MBOS or IMD app, then how many questions at least we should solve, and then what is the best method to review those questions. So first of all, let me tell you guys what are the resources that you have to use through your complete step one preparation. So first of all, the first and the most important resource is first aid step one. So everyone is going to use that book, and that you can say this is a bible for USMLE step 1 exam. If you are going for USMLE exam and you didn't prepare this book very well, try to didn't try to understand the concepts, then it is very difficult to pass the USMLE step 1 exam. So try to have a good clear concept from the topics that are specially mentioned in the first aid step 1 book. So this is the first resource that you guys are going to use. Now we are going to discuss, like, when a person is going to start the first aid, what is the best method and in which way the person should start the first aid. So I am going to tell you guys, let's suppose one person who is going to start the preparation for step 1. So you can say it's the first day of that student. So what are the strategies in which sequence the person should start the first aid? So first of all, there are two methods. One method is you can directly follow the first aid, when you open the first aid, they will the first portion is biochemistry, then second is immunology, then third is microbiology, then general patho and the systems. So this is the first method which you can use, like simply you can follow the first aid and go one by one. So this is the first. Then we have the second method that I personally used during my preparation, and also I am telling to my students to follow this because it is an easy way to start the first aid. So when you are starting the first aid, try to start first from general pathology. Why it is important to start first from general pathology? Because general pathology will help you to know the basic terms which we are going to discuss in the systems, we can say hypertrophy, hyperplasia, then we have like apoptosis, then we have necrosis. So all these are the basic terms. Like when you are going to discuss the cardiovascular system, you will see there is one term like left ventricular hypertrophy. When you are going to discuss the reproductive system, you will say you will see there also endometrial hyperplasia. So these are the basic terms which we have to discuss first. So always start first from general pathology. After completing the general pathology, you guys should start the systems. Now, what is a sequence of the system which a person should use? So always try to start first from the easy system, because you are going to start the preparation for exam, which might take 6 to 8 months. So I think you should start with those system who are not going to give you the hard time. You should start first from the easy system. Let's suppose you can start first from endocrine system. Start from first aid, then after completing the endocrine, you can start the reproductive. So here is another important thing. When you are going to start one system, you have to integrate it with other system. Like endocrine system is correlated with the reproductive system. When you are going to solve the UWord question for endocrine, you will get the question from reproductive system also, because endocrine, we know that in this the main thing is about the hormones, and the hormones are definitely going to affect also you can say different reproductive cycles. So that's why first try to start the endo, then after that you should start the reproductive system. After the reproductive system, you guys can start the respiratory system. So this is the third system, and it is also short. it will not like give you the hard time and you will not get bored. So try to take start from the small systems. After respiratory, you guys can start the renal system. So this is the fourth system, and after the renal system you should start the hematology. So these are the small systems which you guys can like from these system you can take the initiate. So these are the small system. After that we have little lengthy and long systems. Like after that we have CVS system, then CNS system, then we have the musculoskeletal system, and on the ninth we have the GIT system. So these are the important systems which you have to prepare for your exam. If you are planning to go for step 1, so these are the systems which you have to complete before going for exam. So this is the sequence of systems. When you are preparing for step 1, try to follow this sequence. And also we are going to follow this process same. Like today we have the first class, and in this class we will start from general pathology. I will like select the topics from the U word from the NBMEs. Like after the class, if you guys solve the U word question, and when you will practice the like NBMEs or MBOS question, it is going to help you to improve your score. And definitely, like when you read the U word explanation, it also help you to understand that question and that explanation very well. So that's why, first of all, don't miss the class. If you guys didn't understand anything, you can ask anytime. Like you don't have to like hesitate, just drop your question in the WhatsApp group, or you guys can directly DM me also. But it's best to like send a message in the group so that all the person can participate and share their answers. So tomorrow we are going to start first from general pathology. We will first cover the topic, then from that topic we will cover the MCQs from the U word, from the NBMEs, and also we will like take help from the MBOS. So these are the like 2 3 question bank on which we will try to cover the important questions from those topics. After completing the general pathology, we will try to start first from endocrine system. Then we will try to cover again the important and high yield topics which you are going to get in the UWord and again MBOS or NBMS. After completing endo, we are going to start the reproductive system. So this is the sequence which we will follow in this course. So we will try to cover as much as possible so that it will give you a lot of benefit. So these are the important systems. So let's suppose if the person completed the journal pathology and that person is done with all the systems. Now what the next option person with person should choose? So after completing all the system, you have to start the biochemistry. Then after the biochemistry, you can take start from immunology. And after the immunology, you can take start from microbiology. And after micro, you should complete the psychology. And after psychology, we have the behavioral science and biostatistic and ethic portion. So these, you can say, this is the complete syllabus for step 1 which we have to cover. So different people like use different approaches, but personally I use the same pathway. When I am preparing for my exam, so I started first from general pathology. After completing the general pathology, I completed all the systems in that sequence. Then after completing all the systems, I finished these things. So this is the you can say the overview in which you are going to start your preparation. So these are the, you can say, about the first aid things. When you are going to start the first aid, you can follow this sequence. So like some people follow this, some people try to start first from biochemistry, then immuno, then micro, and then they start the system. So you can choose according to your plan, but I think it is a best and easy way to take the start. So that about the resource, only the first aid book is going to be we are going to use for the step 1 preparation. And I also recommend to you guys, please don't use any other book. First aid step 1 is more than enough to cover all the topics for your exam. Now we will talk about the MCQs question bank. Like what kind of question bank we use. Like in the market we have different kind of, like first one is the U word. Then we also have MBOS. Then we have IMD app. then like also nowadays USMLE Fighter. So different apps. So first of all, I personally use for my exam UWord and Emboss. So when I am like in the start of my preparation, I started first from the UWord, and for the biostatistic and the ethics portion, I use the Emboss because I have personal experience, and I have like taught to 1000 plus students, especially who are currently preparing for USMLE and different exam. So from like overall experience, if you completely focus on the U word, it's more than like enough. But some students have enough time, they are done with U word, but they still have 1 or 2 months. Then they can like spend that time with the emboss. You can take a quick review of different system from the emboss. But I personally recommend to you guys, try to start first from the U word. Like if the person is going to start the preparation for step 1, first complete the journal pathology from the first aid, and after completing the journal pathology, solve the U word of this portion. And when you are done with the U word, then again start the endocrine system. When you completed the endocrine system, start this system MCUs from the U word. So in that sequence, if you guys go, then it will become easy for you to know like how many things you completed and what are the things on which you have to focus. So if the person is done with all the things, and that person completed the U word, then you can start the emboss for biostat and ethics. But you guys can also do use the U word for these things. But when you are going to start your preparation, try to start the biostat and ethics question from the first day. Like take the emboss and try to solve the 5 question at least per day from the emboss of biostat and ethics. Because nowadays biostat and ethics portion is highly tested in your exam. So that's why please don't think you are going to start the biostandard ethics at the end of your complete preparation. So take these subjects from the first day. Try to solve 5 to 10 questions. And 5 questions are more than enough, because let's suppose if you are going to have a 6 month for step 1. So if you start from the first day, then each day if you are solving 5 questions, it will give you the strong like knowledge, strong grip on these subjects, because the biostat and ethic portion is also going to same in the step 2 and even in the step 3, because I'm also done with step 2. So biostat and ethic portion is like you can say 80 to 70% is same, but like few things are different. But definitely if you have a basic strong knowledge, then step 2 is not difficult for you guys. So this is the about the resource of question bank. Some people are also using the IMD app, and some are using the USMLE Fighter. So I think it is a personal choice, and it depends on the financial status of a person. If a person can afford, I will say go with UWord. And if you see it's difficult for you to manage, then you can use the IMD and USMLE Fighter. But I didn't use these resources, so that's why I don't have an idea like how these apps are going to work. But I always recommend to my students, please go with that resource that is internationally recommended. If you can afford, then pick the yogurt. If you can't afford, then go with anyone else. So these are about the question bank. Then we are going to discuss if a person is preparing for USMLE step 1, at which stage that person should start the self-assessment test. And that is going to be very, very important, because the students don't know when they should take when they should start the self-assessment test, because these are the tests which are going to tell you like you are at which stage of your preparation. So that's why these self-assessment tests are very important. So now let's discuss, first of all, when you will take the subscription of UWord, you will have there three, I think, USWA 1, USWA 2 and USWA 3. So there are three self-assessment 1, 2 and 3. Then after that we have the NBMEs. Like I think nowadays up to 30 or up to 34 NBMEs are available. So like now we will discuss like when we will start the self-assessment 1, which is USWA 1, USWA 2 and USWA 3. So let's see, if a person is going to start the preparation today, and that person is done with UWord. So this person completed the first pass of your word. After completing the first pass of your word, please try to give the USWA 1 self assessment test, because this is going to tell you like what are the areas on which you are going to focus next. So that's why after completing the first pass of your word, give the USWA 1 test. Then from your weaknesses, and like from this test you will know what are the things on which you have to work more, what are the systems in which you are getting the wrong questions. So after that, start the second pass of your word. I personally recommend to everyone, first pass of your word will be system wise, go system wise, and second pass of your word will be random. So start first system wise, then second pass go with random. And when you done with the second pass, when you are done with the second pass, then start to give the self assessment too. So from this self assessment, you will realize how my score is improved, because you give the self assessment one after completing the first pass. Now you give the self assessment too after completing the second pass. You can compare what are the things you learned from the first pass and how they are going to different from the second pass. So this is the best like plan in which you should give the USWA 1 and USWA 2. Please don't solve the USWA 3. Don't open the USWA 3. This is, you can say, this is uh, for the last days when you are near to your exam. Then after like completing the second pass of your word and after giving the self assessment too, you should start the NBMS. Now the another question, nowadays we have 1 to 33 NBMEs or 34, let's see. So from which NBME person should start the practice? So I personally believe for us the most important are the recent NBMEs, like NBME 28 to 28 to 33 or 34, but some people recommend 25 to 33. So I will say start from the 20 to 25. These are again your self assessment test. Try to give at least one NBME after 1 week or 10 days. So let's suppose you are done with the second pass USWA 2, and now you have to start the NBME. Try to first give NBME 20. From this NBME, you will see what are the topics, what are the systems on which you are again getting the question wrong. So after that, after take a break of for 10 days, don't open any NBMEs. Try to learn, try to focus on the topics which you are getting wrong. So after 10 days or 1 week, give the NBME 21, and please compare your score. If your scores are not above 75 or 80%, please don't go for exam. Don't go for exam, don't take any risk, because I have applied for this year match, and I also get the interviews, alhamdulillah. So it's my personal experience. I have seen some people like who fail their exam. They are really in trouble. They are getting the less interview, or even they didn't get the interview. So it's request to all of you, please don't go for exam if your scores are not consistent. Let's suppose the person give the NBME 20 and he get the score of 85, and when he give the NBME 21, his score is 65. When he give the NBME 22, his score is, let's suppose, again 62, and 21 to 25, his scores are in between 60 to 65. So it's mean this score is not good. You have to work hard, you have to work on your weak areas. So after that, like when you are done with 25, you should start again 26, 27, 28. If your scores are greater than 75 to 80% in 5 to 6 NBMEs consistently, then go for exam. If you get like 75 to 80% in only one NBME, then again please don't go for exam, because sometime it is your luck, you can pass the exam. I am not going to say those who get the score in 60, they are not going to pass the exam, but I always tell to my students, don't take any risk. You will see many posts, the person is getting score in 65, he go for exam and he pass it. I have also seen these kind of posts, but this is not the majority. Like you can see, these are the random people. Like if we have the 100 students, so five or six students, like who are the example of these kind. So that's why don't like rush, don't follow the like any other person, especially who is going to you can say distract you, and who is not like going to help you. Stay away from those kind of people and focus just on your preparation. You will see your score. If your scores are good, if your scores are improving, then go for exam. So this is about the NBME. And please don't solve the NBMEs before the uswato. So this is the like complete schedule in which you guys have to start your preparation. Then with preparation you have to start the U word. After U word you have to start the self assessment, and after self assessment you have to start the NBME. And please when you're done with all the NBMEs, after that you will go for USWA 3. It's when I am going for step 1, I started my USWA 3 10 days before exam. So try to give the one NBME 15 days before exam, and try to give the USWA 3 10 days or 1 week before the exam, so that you can get a real stimulus and you can sit. And after that you have free 120. When you are done with the NBMS, you have free 120. So I think nowadays again there are new free 120 and old free 120. But whatever the kind is, you should start to solve the free 120 3 or 4 days before your exam. And I know like when I go for exam, these are the free 120s which are really like help me to which I really found helpful in exam, because some of the topics they are really you can say tested from these things. So the main thing is, if your score is improving, if your NBME scores are improving, and your like free 120 scores are good, then go for exam. And like don't go for exam if your score in any one self assessment or second self assessment is in between 65 60. You are not going to take the risk. If you want to take the risk, then definitely you can take on your behalf, but I will not recommend. Go for exam when you are fully prepared. And no worries if you have to like cancel your triad, do it, because it's more important than your result. So when you are going to apply for the match, these are the things when you will realize. If your scores are little low, you will really get a depression. You will say, oh, my scores are not good, that's why I'm not getting the interview. So a lot of things in mind at that time. So that's why go for exam when you are ready, and when your scores are consistent and they are improving at least 75 to 80. Before that, I will not say you should go for exam. So this is the complete, you can say, preparation method. You have to start from the first aid, complete one thing from the first aid. When you complete that thing from the first aid, start the U word. If you are using emboss, you can use the emboss, but I will say please use the emboss first of all only for biostat and ethics portion. If you are done with U word, if you are done with biostat and ethics portion from the emboss, and you still have enough time, then you can practice these system MCQs from the emboss. This is I have seen many students who are following this. Most of the people they use the emboss as a secondary source when they are done with U word, or they have to like complete the emboss and ethics. So this is the, you can say, complete method in which you guys have to do. Now let me tell you what we are going to learn in the online classes. So this is the study schedule which you guys have to follow. Now let's see how this online classes are going to be work. So first of all, again we have daily a 1 hour online class. Each day we have class at 6 p.m. Pakistan Standard Time, and it's approximately I think 8 a.m. EST time. You can like check the time according to that. So each day we have 1 hour class, and in this class, like from tomorrow, we are going to start first from journal pathology. I will pick the important concepts, important topics. First, I will give you the lecture on that topic, and at the end of the lecture, I will share the important points from the U word, from the NBMs. Let's suppose tomorrow we will start the topic of apoptosis. So I will let you know, guys, like what are the things they what are the things tested in the U-word or NBME or the MBOS on this topic. So inshallah, the topic which we are going to discuss, they are really important for your exam, and definitely you will get the question in the U-word, in the MBOS, in the NBMEs, and even in your real exam. So that's why try to stay focused when you are in class, and after the class, if you have any problem in any topic, you guys can let me know. We are going to start first from the general pathology. Each day we have 1 hour class, and the class will be from Monday to Saturday. Sunday will be off, but definitely sometime we might have class on Sunday. So these are the things which I want to tell you guys in the orientation class. If you guys have any question, please go ahead and can ask.